What if Queen Camilla's reported health crisis had nothing to do with public pressure and everything to do with a battle for control inside the royal household? According to the source script, the timing was extraordinary. Camilla's alleged decline supposedly began just as King Charles was preparing a major change involving the royal family's finances, giving Princess Anne greater control over the institution's private financial affairs. And that is where this story turns from a health story into a power struggle. The first thing to understand is the money. The privy purse is responsible for the monarch's private finances and various internal expenses connected with the royal household. Control over those resources means influence over how money moves through the institution. The source claims Charles wanted Princess Anne to take a stronger role in overseeing those finances. On the surface, the decision would make sense. Anne has a reputation for discipline, efficiency, and an extremely demanding work schedule. She has spent decades carrying out royal duties without chasing publicity or unnecessary attention. But according to the allegations in the source, the proposed change created a serious problem for Camilla. If Anne gained greater control over financial affairs, Camilla's influence would supposedly become much smaller. And the source claims that this was when Camilla's alleged health crisis suddenly became serious. She was reportedly described as suffering from severe mental exhaustion and major depression. But there is an important distinction here. These are allegations contained in the source material, not established medical facts. The script claims that Camilla's condition was presented to Charles as the result of overwhelming public pressure. The alleged strategy was simple. If Charles believed his wife was seriously unwell, he might reconsider giving Anne control of the finances. The source goes even further, alleging that Camilla secretly approached a private physician and asked for a medical report supporting the diagnosis. According to the story, the report describes severe mental exhaustion and major depression. The alleged purpose was not simply to document an illness, but to influence Charles's decision. Camilla was then supposedly seen appearing exhausted and emotionally overwhelmed in front of the king. She reportedly asked Charles to reconsider the financial changes. More importantly, she allegedly suggested that being given greater responsibility would actually help her recover. In other words, the position of power was presented as part of the solution to the health problem. That would already have been a serious accusation. But the source claims the demands did not stop there. Camilla allegedly wanted Charles to make a written commitment involving valuable royal jewelry and symbolic collections associated with the late Queen Elizabeth II, including provisions benefiting her children from her previous marriage. That changed the appearance of the situation. What initially looked like a request for emotional support was beginning to look, according to the allegations, like a broader attempt to secure financial and institutional power. And Princess Anne allegedly noticed. Anne is portrayed in the source as someone who pays close attention to inconsistencies. The story claims she noticed Camilla making private phone calls whenever Charles left the room. The calls were supposedly quiet, deliberate, and focused. That behavior allegedly raised questions because it did not match the image of someone who was supposedly too exhausted to function. Anne then began investigating. The source claims that she used a trusted palace employee to gather information about Camilla's communications. Eventually, the investigation allegedly connected Camilla to the same private physician who had prepared the controversial medical report. According to the source, Anne confronted the doctor directly. At first, he allegedly defended the diagnosis, but when confronted with communications and call records, the doctor supposedly admitted that the report had been fabricated and that financial compensation had been discussed. Again, these are claims made by the source and are not independently established facts. But within the story, this is the moment everything changes. Anne now supposedly had three things: a medical report, communications, connecting Camilla to the doctor. And the doctor's alleged confession. She took the evidence directly to Charles. Imagine the situation from the king's perspective. He believed his wife might be suffering from a serious health problem. He had been reconsidering an important financial decision because of her condition. And suddenly he was being shown evidence that, according to the allegations, the entire situation had been deliberately constructed to influence him. The betrayal would not simply be personal, it would involve the finances and internal operation of the monarchy. The source claims Charles responded by calling an emergency meeting of senior royal officials. And this time, the physician was allegedly brought into the room. According to the story, The doctor repeated his confession in front of the group. He supposedly explained how the medical report had been created, how Camilla had approached him, and how financial compensation had been discussed. If true, the situation would have become impossible to dismiss as a misunderstanding. Charles then allegedly reversed every consideration that had been made regarding Camilla's access to royal finances. The source claims she lost authority over resources, budgets, and internal affairs. But the alleged punishment went even further. Camilla was supposedly ordered to leave Buckingham Palace immediately. The story describes her leaving the palace grounds in the rain, devastated and pleading with Charles to reconsider. But the source argues that the most important part was not the dramatic scene outside the palace. It was what had supposedly happened before it. If the allegations were accurate, Camilla had not simply been overwhelmed by pressure. She had allegedly built a strategy around that appearance of vulnerability. The health crisis became leverage, the financial position became the objective, and the king's compassion became the mechanism through which the plan was supposed to work. That is why Princess Anne's role is so important to the story. She was not portrayed as someone who wanted the spotlight. She did not need a public confrontation. She allegedly focused on the details that did not make sense: the timing, the phone calls, the medical report, the financial demands, and the people connected to the process. That is what supposedly exposed the larger picture. But there's another issue underneath the entire story. The monarchy has always had to maintain a boundary between royal institutional resources and the private interests of individual family members. Once those two worlds become blurred, the consequences can become enormous. The source claims that Charles ultimately viewed the alleged manipulation as more than a disagreement between husband and wife. It was presented as an attempt to redirect institutional authority and valuable assets toward private interests. And that is why, according to the story, the response was so severe. Camilla's access was allegedly removed. Her influence over finances was supposedly eliminated. And the royal household was forced to reconsider how much authority could safely remain concentrated around individual family members. But the story does not end with Camilla leaving the palace. There are bigger questions. Would Charles ever trust her again? Would her children attempt to challenge the financial decisions? Would Camilla remain completely silent? And most importantly, what would happen to the balance of power inside the royal household? The source ultimately presents Princess Anne as the unlikely person at the center of the entire episode. Not because she demanded power, not because she wanted attention, but because she allegedly noticed something that others overlooked. A story that began with a reported health crisis became an investigation into money, influence, medical claims, and institutional control. And if the allegations in the source are true, the most important lesson is not the dramatic confrontation or the supposed removal from the palace. It is the importance of following the timeline, because sometimes the most revealing part of a scandal is not what someone says. It is when they say it. The alleged health crisis appeared at the exact moment a major financial decision was being considered. The financial demands reportedly expanded beyond the original issue, and the investigation allegedly uncovered communications linking the key people involved. Whether every allegation is true is another question entirely. But within this story, Princess Anne's greatest advantage was simple. She paid attention. And that is why the source portrays her as the person who ultimately uncovered the alleged plan. A quiet royal, a meticulous investigator, and, according to the story, the one person who was not distracted by the tears, the drama, or the claims of weakness. Because when power is involved, appearances can be carefully constructed. But timelines, documents, communications, and financial records are much harder to control, and that is where this alleged palace power struggle supposedly began to fall apart.